Okay, so this is my trauma video. I have a 40-year-old female who has been in a motor vehicle accident. I have my PPE on, scene is safe. Number of patients is 1. Mechanism of injury is from the vehicle accident. I would call for ALS and possibly even CHP to help with traffic control and need for C-spine. I would consider C-spine and I would do it at this time because of the mechanism of injury. General impressions, I see her laying on the ground. She is unconscious. Ma'am, are you okay? She doesn't respond to pain, so she is unconscious. And chief complaint is motor vehicle accident. Then I would check her ABCs. So her airway, open up her mouth. The airway seems to be clear. Her breathing seems a little shallow, so I would take a listen. Um, it sounds clear, but she is taking shallow breaths, so I would consider doing an OPA, and I would give her a non-rebreather mask with high flow oxygen. Circulation, I would check pulse. Has a pulse, but a little weak. Um, I would check capillary refill. Also, skin signs. She seems a little pale. Um, I would treat her for shock, so I would put a blanket over her. Since we would take off her clothes to give her a head to toe examination, I would make her a priority patient, so I would want to transport her as soon as possible to the nearest hospital. Um, I can't obtain a sample. I could try and get a sample from family members if they're around, or any bystanders that saw the accident, but otherwise, because the patient is unconscious, I will not be able to obtain a sample. So I'm going to start with my head to toe. So I start with the head and I'm looking for decap BTLS, so deformities, contusions, abrasions, punctures, burns, lacerations, swelling, and tenderness. So I start at the head, looking at the scalp. I look at the eyes to make sure they're both dilated correctly. They're both equal. I check around the cheekbones. I check the ears for CSF. Um, I check inside the mouth, the nose to see if there's any bleeding. I don't see anything so far. And I go down to the neck. I check if the jugular vein is distended, which is not. I check that the trachea is in line, and then I can check her cervical spine in the back, which everything seems to be good. All while looking for decap BTLS all the way down. I go to the chest. I palpate the chest for decap BTLS. I already listened. Everything feels fine. Then we go down to the abdomen. So we palpate the abdomen. If it's soft or hard, everything seems to be fine. And then I go down to the pelvis and I want to check if it's broken. Decap BTLS. It seems fine. And then we check out one leg at a time, going down, looking for decap BTLS. I check the pedal pulses when I'm down here. And then I go to the other leg looking for decap BTLS. Everything seems to be fine. Go down the left arm, or the right arm, excuse me. And it seems that she has a broken arm. So um, I will come back to that injury, go down this arm, looking for decap BTLS. Um, and then on the person's head count who's holding C-spine, we would roll her over, and I would check her back and spine for decap BTLS all the way down. Seems okay. We would get a backboard. We would put the backboard under her, roll her back over, um, and then I would, if I had time or in the back of the ambulance, I would treat that broken left arm. I would reassess this patient every 5 minutes and checking vital signs, like blood pressure, her oxygen levels, pulses, um, until we got to the hospital.